Ωραία.
Εντάξει, το πάω στην αρχή.
Ωραία. Λοιπόν, 3, 2, 1, πάμε.
Good morning, dear colleagues. My name is Vlasios Kakouris. I am a PhD candidate in the Dental School of Athens in an interdepartmental PhD program between Dental School and Medical School of Athens. This systemic review is about the dental erosion associated with intensive and recreational swimming in chlorinated swimming pools. Introduction. What is dental erosion? Dental erosion is an irreversible loss of dental architecture due to chemical dissolution generated by acidic substances with the important detail of not bacterial activity. This is a typical image of dental erosion. Which factors are associated with the development of dental erosion? These factors can be distinguished in the extrinsic ones, exposure to acids in the working space, or a frequent consumption of acidic drinks and foods, and oral admission of acidic medication. On the other hand, we've got intrinsic factors, such as conditions concerning digestive and eating disorders, and on the other hand, conditions that could create xerostomia. However, the development of dental erosion is an interplay of various biological, behavior, and chemical factors. What is the prevalence of dental erosion in the general population? It is considered to be the most common condition on individuals between the age of 5 and 17 years old. On the other hand, in adolescents, we've got a span between 11 to 100%. In the adults area, the percentage is 4 to 82%. However, there's at the moment the usage of indexes, populations, and examiner methodology makes it very difficult to illustrate a more efficient image of the dental erosion prevalence in the general population. What is actually happening concerning swimming pools, water properties, and facilities? The factors that influence the erosive effects in gas chlorinated swimming pools are, on one hand, the general maintenance, the pH neutrality, disinfectant agents, and the saturation in calcium and phosphorus. And on the other hand, habits of athletes, which are either the total years of exercise and the total time of exercise per week. However, prevalence studies concerning dental erosion in the swimming pool area have the findings of 25 to 94% of dental erosion concerning swimmers. Materials and methods of this systemic review. The study identification was narrowed between 1985 to 2021. We used all the major internet platforms and a thorough research in the archives of the Dental School of Athens. The results can be seen in Table 1 and the total number of relevant studies found. We had to develop study selection criteria by first focusing on the observational studies for this systemic review. The selection criteria involved age group specification, examination properties, questionnaire details, and of course the language. We've concluded in selecting 5 major observational studies in the field. In addition to this, we developed configuration tool in order to assess bias. And this was supported by reporting, performance, and selection criteria. We use the score of specified, not specified, and partly specified in order to reach conclusion in this configuration, which can be seen in the table. The results concerning reporting quality, as you can see in the bar chart, most of the studies had either not specified or not fully specified data. In addition to this, concerning the performance bias, not specified or not fully specified data also existed in all of the studies. Concerning the other type of bias, which is whether sponsoring or not existed, not such findings were. Discussion. Studies have revealed in many cases problematic protocol-based procedures in acquiring and standardizing the pH in swimming pools. The swimming pool water, even if it's neutral in pH, if it's low in Ca saturation, it can promote the erosion procedure through the constant interaction with the oral cavity. And this finding comes in accordance with the chelation, calcium and phosphorus properties, which can play a long-term role in the development of dental erosion in swimming pool athletes. Finally, the studies examined in the systemic review presented with a high relevant number of unspecified or not fully specified data, which as a fact amplifies the bias risk. Conclusion of the systemic review. Swimmers in swimming pools are susceptible to developing dental erosion, as we've seen in the prevalent studies. Various factors with potentially erosive properties are involved in swimming pools and are associated with each other. And finally, the results of this systemic review highlight the requirement of further scientific investigation in this field to reach more accurate conclusions. Thank you for your attention.
Ωραία, σας ευχαριστούμε πολύ.